Hello, this is Dr. Emma Hitt-Nichols, and this is the information on the latest US FDA approvals for the week of March 11th through the 15th, 2024. First up this week, we have the FDA approving lisocabtagene, maraleucel, also called Liso-cel or Breyanzi, for the treatment of adult patients with relapsed refractory chronic lymphocytic leukemia, CLL, or small lymphocytic lymphoma, SLL, who have previously received at least 2 prior lines of therapy, including a BTK inhibitor or a BCL2 inhibitor. Liso-cel is a CAR T-cell therapy, which involves genetically modifying a patient's own T-cells to express chimeric antigen receptors, CARs, that specifically target tumor antigens. The approval of lisocabtagene maraleucel was based on results from the phase 1/2 TRANSCEND CLL 004 study, which demonstrated a complete response rate of 20% among participants with a median duration of response that had not been reached at the time of data cutoff. The study found that 100% of those achieving a complete response maintained their response at 12 months, with an 87.5% maintenance rate at 18 months. The overall response rate observed in the study was 45%, with a median duration of response of 35.3 months. The approval of lisocabtagene maraleucel was granted to Bristol Myers Squibb. Also last week, the FDA approved Tislelizumab-jsgr, also known as the brand name Tevimbra, monotherapy for patients with unresectable or metastatic esophageal squamous cell carcinoma, ESCC, following prior systemic chemotherapy, not including a PD-L1 inhibitor. ESCC, the most common histologic subtype of esophageal cancer, is aggressive in nature, and options for those who have failed first-line treatments are limited. The approval was based on the phase 3 RATIONALE 302 trial, which enrolled 512 patients across 132 research sites in Europe, Asia, and North America. The trial demonstrated a significant improvement in overall survival for patients treated with tislelizumab compared to those receiving chemotherapy, with an overall survival of 8.6 months versus 6.3 months in the chemotherapy arm. The approval of Tislelizumab-jsgr was granted to BeiGene. And now a word from the supporter of this podcast, Nascent Medical. Attention all businesses in need of exceptional medical writing support. Nascent Medical is the solution. We are a team of skilled MD and PhD level medical writers who specialize in fast turnaround needs assessments, manuscripts, slide decks, ad board summaries, and more. Don't settle for anything less than excellence when it comes to your medical writing assistance. Visit nascentmc as in medicalcommunications.com. That's nascentmc.com. We are here so that you never have to be without excellent medical writing help. Also last week, the FDA approved Resmetirom, that's also called Resmetirom, for adults with non-cirrhotic, non-alcoholic steatohepatitis, also called NASH, and that's with moderate to advanced fibrosis, along with diet and exercise. This marks the first time a medication has been approved to directly address liver damage in patients with NASH who also have notable liver scarring. Resmetirom acts as a partial activator of a thyroid hormone receptor, reducing liver fat accumulation by activating this receptor in the liver. An estimated 6 to 8 million people in the US are affected by NASH with moderate to advanced liver scarring, and the disorder is often associated with comorbidities such as high blood pressure and type 2 diabetes. The approval was based on findings from a 54-month randomized double-blind controlled trial evaluating the safety and efficacy of Resmetirom. The trial utilized a surrogate endpoint at month 12 to measure the extent of liver inflammation and scarring. At 12 months, liver biopsies revealed that a greater proportion of subjects treated with Resmetirom achieved NASH resolution or an improvement in liver scarring compared to those receiving placebo. Resmetirom was granted approval under the FDA's accelerated approval pathway, which requires a post-approval study to confirm the drug's clinical benefit. The FDA granted the approval of Resmetirom to Madrigal Pharmaceuticals. Also last week, the FDA approved Maralixibat, also called Livmarli, oral solution for cholestatic pruritus in patients aged 5 years and older with progressive familial intrahepatic cholestasis, PFIC. Maralixibat is a once-daily orally administered ileal bile acid transporter inhibitor. Maralixibat is already indicated for cholestatic pruritus in patients with Alagille syndrome. PFIC is a rare genetic disorder that leads to progressive liver disease and potentially liver failure. The approval of Maralixibat was based on the outcomes of the phase 3 MARCH clinical trial, which enrolled 93 patients with various genetic types of PFIC, demonstrating its efficacy in a broad range of patients. Additionally, the manufacturer, Mirum Pharmaceuticals, has submitted a supplemental new drug application for a higher concentration formulation of Maralixibat evaluated in the MARCH study, aiming to extend its use to younger patients with PFIC. Also last week, a supplemental biologics application was accepted for Guselkumab, also called Tremfya, for the treatment of adults with moderate to severely active ulcerative colitis. This submission is based on the results from the phase 3 Quasar program, which demonstrated a significantly greater percentage of patients achieving clinical remission at week 44 with Guselkumab compared to placebo. The program evaluated the efficacy and safety of Guselkumab in individuals with moderate to severely active ulcerative colitis who had an inadequate response or intolerance to conventional therapy, prior biologics, and/or JAK inhibitors. Guselkumab is a dual-acting IL-23 inhibitor that not only blocks IL-23, but also binds CD64, a receptor on cells that produce IL-23, making it a novel agent in the treatment of ulcerative colitis. Guselkumab was first approved in the US in July 2017 for the treatment of adult patients with moderate to severe plaque psoriasis, and also in July 2020 for adults with active psoriatic arthritis. The approval of Guselkumab was granted to Johnson & Johnson. All right, that's it for this week. Please do rate and review this podcast. That'd be really great. And tell your colleagues about it if it's of interest or help to you. I appreciate it. Thank you so much. And I also want to let you know at learnamasstyle.com, if you're listening to this on Monday, my brand new program, AI in Medical Writing and Editing, is closing for registration tomorrow. So if you're interested, just check that out at learnamasstyle.com. And there's also free downloads there and a free course on ChatGPT-4 and medical writing and editing. So check that out if you might find that helpful, learnamasstyle.com. All right, thanks so much and have a great week.